Imagine getting a raise at work, only to discover that a significant part of your new money has already disappeared before you even see it. It didn't go to income tax, and it didn't go to rent. It vanished because the cost of staying insured has gone up again. Look at this chart tracking employer-sponsored health insurance in 2025. The average annual premium reached $9,325 for an individual and almost $27,000 for a family. That family figure jumped 6% in a single year. Employees don't usually pay that entire premium themselves. The cost is split. On average, the employer pays roughly $20,143, while the worker contributes $6,850 out of their own pocket. But the premium is only the entry fee. An American worker can pay thousands of dollars every year simply to have health insurance and still face a deductible before the company actually pays for most services. Today, 88% of covered workers have a deductible. For a single worker, it averages $1,886, and that specific cost has risen 17% since 2020. Then you add copayments, co-insurance, and prescription costs, pushing you toward your out-of-pocket maximum. Nearly 3/4 of covered workers face an individual maximum above $3,000, and 21% face a maximum above $6,000. This creates a strange reality. You can pay your premiums every single month to hold a comprehensive insurance card in your wallet and still spend thousands of additional dollars when you actually get sick. To understand why this keeps happening, we have to look past the insurance company and look at the entire United States economy. This graphic represents the whole country's economic output. In 2024, the U.S. spent $5.3 trillion on healthcare. That is $15,474 per person, taking up 18% of the entire U.S. economy, and it is growing rapidly. Overall healthcare spending increased 7.2% in 2024. Within that slice, private health insurance spending jumped 8.8% to $1.64 trillion, and out-of-pocket spending alone reached $556.6 billion. General inflation doesn't fully explain this. Medical prices only increased about 2.5% in 2024. The massive increases come from non-price factors. Americans are consuming more healthcare, and the specific treatments they use are getting far more expensive. We can break down where that money goes using a tree map. Hospital care is the largest single category, representing 31% of spending, or $1.63 trillion. That outpaces physician services at 21% and prescription drugs at 9%. There is a crucial detail hidden in those hospital numbers. The price private insurance pays for care is often drastically higher than the price paid by government programs. For the exact same broad category of hospital services, commercial insurers frequently pay 267% of the traditional Medicare rate. This gap exists because of bargaining power. Over the years, hospitals have heavily consolidated. In 83% of metropolitan areas, one or two health systems now control at least 75% of the inpatient hospital market. When a local hospital system holds that much market power, insurers lose their leverage. Since 2019, hospital prices paid by private insurers increased approximately 30%, compared to just a 21% increase in Medicare rates. When an insurer has no choice but to agree to higher hospital prices, those costs don't simply vanish. Insurers absorb the higher claims and eventually push those costs directly back to the public through higher premiums and deductibles. Pharmaceuticals follow a similar upward trajectory. Spending on prescription drugs reached $467 billion in 2024. Driven by extraordinarily expensive new therapies, retail drug spending has averaged a 7.8% annual growth rate since 2020. But the average worker doesn't usually feel this macroeconomic inflation directly. If an employee earns an $80,000 salary, they rarely look at their bank account and realize their employer is secretly spending an additional $20,000 to keep their family insured. Everyone involved is looking at a different fragment of the exact same system. The employee sees a paycheck deduction. The employer sees an operational expense. The hospital sees a reimbursement. The insurer sees a claim. And the pharmaceutical company sees revenue. Because of this fragmentation, basic free market competition completely fails. When you buy a television, you can compare prices or wait for a sale. When you're having a heart attack, you are not shopping around for the cheapest emergency room. That removes the basic consumer pressure required to drive prices down. We also have to account for biology and time. America is aging, and older populations use more healthcare. In 2024, Medicare spending hit $1.12 trillion, taking up roughly 21% of all national health expenditures. At the same time, we face the central paradox of modern medical technology. New biological drugs, advanced surgical techniques, and early diagnostics are incredible at extending lives, but they demand massive financial investments from the system to do so. Depending on how you buy insurance, the costs look wildly different. This graph tracks the Affordable Care Act marketplace, where the average 2026 premium for a 40-year-old is around $625 a month. But for consumers receiving advance premium tax credits, an average $741 premium can drop down to just $178. But we have to look at the true financiers of the system. Households account for 28% of national health spending. The federal government covers 31%. Private businesses fund 18%, and state or local governments cover 16%. Government subsidies and employer contributions make coverage affordable for individual households, but they do not solve the macroeconomic problem. Shuffling the financial burden between taxpayers, businesses, and patients does not eliminate the massive underlying medical invoice. The government projects this math will only get more extreme. Over the next decade, national health expenditure is expected to grow by 5.4% annually, outpacing the overall economy's 4.1% GDP growth. By 2034, healthcare will consume 20.6% of the entire American economy. For the average worker, this translates into a highly specific sequence of financial pain. First, your paycheck deduction rises. Then your deductible gets higher. Then the copay appears, followed by coinsurance and prescription costs, all acting as hurdles before you finally hit your out-of-pocket maximum. You can see the explosion by looking at the last 10 years of data. In 2015, the average employer-sponsored family premium was $17,680. By 2025, it expanded to nearly $27,000. The total family premium surged 53%, and the specific contribution demanded from workers rose from under $5,000 to almost $7,000. This level of out-of-pocket exposure alters human behavior. We now have a system where fully insured individuals will actively avoid scheduling a medically necessary doctor's appointment out of fear of the final bill. If healthcare costs rise, someone has to absorb the increase. The hard truth is, we cannot make health insurance cheaper without first figuring out how to make healthcare itself less expensive. Until we lower actual hospital pricing and the cost of treatments, insurers will keep receiving higher medical bills, and they will keep passing those costs down